Okay, just wanted to follow up with a very quick video about the questions that we saw on module. I also wanted to mention the Connecting Cultures Healthcare Interpreters video that you saw. Wanted to let you know that that is a really good source for getting some of these tips and tricks. They do put together short videos like the one that you just saw with really good information for new interpreters, but also even for existing interpreters. So I just wanted to mention that very quickly. So let's take a look at the questions that we saw that I posed to you in the module. So first off, the question was, if the child speaks English and the child is the patient and the provider is speaking directly to the patient, to the child, should the interpreter interpret? And the answer to this is yes. So most likely the parent will be present. Parents will be present because this is a pediatric patient. And so based on what we know about transparency, we know that part of being transparent and complete and accurate, which is the responsibility of the interpreter as well as a part of the code of ethics. And so what that means is that anything that is said in the room, everyone needs to be aware of it. So anything that is communicated needs to be accessible to everyone. And so even though the patient might be the child and the child speaks English and the provider is able to speak directly to the patient, if the parent is in the room, then you have to interpret for them so that they are also aware. And of course, we're talking about a parent that doesn't speak English. Otherwise, why would you be there? The mode that you would have to interpret that in, now again, because the patient and the provider are able to speak directly to one another without the assistance of an interpreter, then they're not going to be pausing, right? So they are going to be speaking back and forth because they speak the same language. And so there will not be pauses for you to interpret in the consecutive mode. In this case, then, you will have to interpret in simultaneous mode. And on the screen here, you see that I say simultaneous or chuchotage. And chuchotage, it might be necessary, especially when it comes to the size of the room, because again, part of our code of ethics is we don't want to be something that impedes communication, right? We want to, part of being transparent is also not being a barrier to communication. And so we don't want to sort of speak over the provider or the patient even, so that either they can't hear each other or they sort of get interrupted or lose their train of thought because we are distracting them with our interpretation. So interpreting simultaneously and doing it in what we call whisper interpreting or chuchotage might be necessary in this case. Okay, let's take a look at another situation or other situations that might include mixed language abilities. So in this first one here that you see, it says one or two parents are present. The child does not speak English. In this case, again, because the child is the patient, of course you will have to interpret because the patient does not speak English. So that one's kind of an easy one. The next one says one or two parents are present, child speaks English, and that's the one that we just talked about, right? Another possibility is two parents are present, the child and one parent speaks English. So for example, let's say mom and dad are at the child's appointment. Mom speaks English, the child speaks English, but dad doesn't speak English. And so again, in this case, you will find that the patient and the provider and the patient's parent, the mom who does speak English, might start talking and having conversation with the doctor directly and may not allow for pauses for you to interpret. This one can also get a little bit tricky because in this case, it's going to be very important to keep up and keep with the same pace because, for example, if a doctor asks a question to both parents, you have to be close enough in the conversation with your interpretation to also allow the parent who doesn't speak English to hear the question and be able to have a chance to interpret in the natural flow of the communication. So, for example, you don't want to be very, very behind where the doctor's asking questions like, when was the last time you had something to eat? And then mom answers in English, and then the doctor moves on to, how much did he eat this morning? And then again, you're behind with the questions, and the doctor then moves on to another question, like maybe even possibly about a different topic. How much did he weigh at birth? And so if you're too far behind, you haven't given dad the opportunity to also give an answer or maybe discuss the answer. You haven't really given them the opportunity to participate in the conversation because the interpreter is sort of way behind. And so in this case, you are going to be interpreting simultaneously, like we talked about in the other cases, but it's going to be very important that as the interpreter, you understand that the pace is going to be important, that you can't fall so far behind. Otherwise, the dad in this case would not be able to participate in the conversation naturally, in the natural flow of the communication. And the next one that you see here is one or two parents are present, both speak English, and the child does not speak English. And this doesn't happen very often, but it does happen. I have seen it happen. I've actually seen it happen a bit more often with patients as a Spanish interpreter, with patients who are children and who are immigrant children whose parents came to the United States first. And then the parents, after a while, were able to save enough money to also bring the children to the United States. And so the parents might have had the opportunity to learn some English or to learn to speak English, but the children are newer to the country and are still not fluent in the language or still not comfortable speaking English. So it does happen. It doesn't happen as often as the other way around. Usually the children speak English sooner than the parents, but it does happen. And so in this case, sometimes the providers might feel inclined to speak to the parents instead of the child in this situation, just because the parents might speak English. But again, our job as interpreters is to allow patients to have as much as possible the same experience that an English-speaking patient would have. And so if, for example, the patient is a 10-year-old or a 6-year-old, someone who the doctor might actually try to build a rapport with and who they might actually ask questions directly to if they spoke English, we want to allow that patient the same experience that an English-speaking child would have. And so as interpreters, our job is going to be to understand what mode of interpretation we have to go into in order to actually allow for direct communication and effective communication between these two folks, the doctor and this child who doesn't speak English, but whose parents do. So we have to understand that we may have to be a little bit more alert and on task and on time with our interpretation so that the doctor doesn't sort of fall back and say, well, it's kind of taking longer if I'm waiting for the child. And sometimes it happens unconsciously where they don't mean to dismiss the child, but because the answers are coming quicker, they'll sort of move to just speaking directly to the patient's parents who do speak English. And so that child sort of gets taken out of the situation, at least a little bit, where an English-speaking child would not have been taken out. And so we can help the provider not fall into that trap. We can help the patient's parents and child not fall into the trap by being effective interpreters and knowing how to manage the communication in this type of situation. All right, so in this last slide, I want to talk about considerations when interpreting for children. And I think that Rochelle, in the video that you watched, sort of explained this nicely. My unconscious bias might say, Yenny, this is a child, and so I may unconsciously want to lower the register. And so if a person says cardiologist, I might be tempted to say the heart doctor. I want to again caution you that that would be our own bias. That might be my own bias because I have a child myself, or I have worked with children myself, and maybe I personally wouldn't use this type of terminology with a child. And so even though I am hearing the provider use a certain register, my unconscious bias might make me lower my register. And so I want to caution you against that because, again, we as interpreters always match register. Now, we're also going to match tone, and this is going to be very important because the provider, regardless of the register that he or she is using, these are two separate things that we have to match. We have to match register and we have to match tone. And I put these two together as well because while in certain situations, the provider might use certain words that you may not use with a child that age, what they might be doing is they might be changing up their tone to help the child understand these terms. And so instead of lowering the register because they are a child, they might be changing their tone to help them out in that way. Now, something that you will have the opportunity to change if you want is your own professional introduction. That you can make adjustments to. For example, normally I would say, I will be interpreting during your appointment. So I could possibly change it to, I will be saying everything that the doctor says in Spanish so that you can understand it, and I will be saying everything that you say in English so the doctor can understand it. All right, the other thing that you could make changes to would be to positioning. And with positioning, again, if you have, for example, a child and a parent, you're not going to say to the parent, excuse me, parent, there is only one spot that's next to the child. The child is the patient, and my protocols say that I have to stand next to the patient. So mom, you sit somewhere else, and I'm going to sit next to the child. Now, think about how that would go over, right? So it wouldn't go over very well. It might be necessary for you to, instead of being on the side of the patient and the patient's family, it might be easier for you to be by the side of the provider. Okay, and the last thing I'm going to warn you about or caution you about is I have seen interpreters who think, okay, this is a pediatric appointment. I'm going to dress a certain way. I'm going to bring some toys. I'm going to be more playful because it's a child. Again, please, please, please do not do that. That's what child life is there for. That's what parents are there for. That's what doctors are there for. This is not part of the scope of the interpreter. And you may think that you are doing a good job by possibly making the patient feel more comfortable, maybe being thoughtful of the fact that this is a child. But again, please do not do that. That is not part of our scope. We could be, instead of helping, making things more difficult. Don't bring bubbles. Don't bring anything that's going to put you into that encounter. So remember, you are there to interpret and facilitate communication, and that's it.